the bed. The camera.
All right, so we are ready when you are. If you want to start with a brief introduction of yourself. Thank you so much. And I'm sorry, everyone, for all the technical difficulties. Let's go ahead and get started.
Yes, good afternoon. I apologize. I know this is only 30 minutes and talking about stress and burnout, what a way to start this. So I do apologize. I'm Dr. Ares-Romero. I'm an associate professor for the University of Miami. I'm also on the board of the Dade County Medical Association as the vice president, and I'm very happy to be here with you today. And again, apologize for the inconvenience, but let's get started. So, one of the things I wanted to talk about is just really, what's been going on, what are the state of affairs right now, and the reports from surveys done by the AMA and by the physicians groups have shown that the increase in what we are experiencing as burnout, stress, anxiety, overload has increased exponentially. So we're talking about 38% of physicians reported experiencing anxiety or depression in the time of May 28th to October 1st of 2020. 43% were reporting suffering from work overload, and 49% had burnout. The 2021 survey of American physicians, about 2,500 physicians were interviewed. The majority, which meant about 61% of those physicians, reported some kind of burnout in the past year. And this is more than the national average for non-physicians where they experience this. And the interesting thing is also that, despite physicians reporting stress, reporting anxiety, reporting feelings of anger, only about 14% sought any kind of help. So this is a problem. We have to be aware and know our limitations and know, when do we need to ask for help? When do we need to really, talk to people that are compassionate and they're supportive and going to help us? Again, 45 is usually the number of physicians that are 45% are really struggling. Now, the other thing that was interesting is 46% reported increased loneliness during the time of COVID and post-COVID. And how were they dealing with the stress? And this is true for all of us, right? And I think the general population, 29% of US doctors said they dealt with it by eating more. 19% said by drinking more alcohol, and 2% by taking more prescription medications, which included stimulants. So what is burnout? We talk about burnout all the time, but it's really a psychological syndrome. And it's characterized by feelings of exhaustion, reduced efficacy in the professional setting, depersonalization, and lots of negativity. And of course, this really affects, the social economic spectrum for the entire United States, right? Because it's associated with negative consequences on patient care, physician workforce. We've heard about the Great Resignation. So a lot of physicians are either reducing their hours or not working as much because they just don't feel satisfied with this passionate work that they decided to do early on in their careers. And of course, the healthcare cost is really important, and it affects physician safety. And the correlation does exist in the literature with the increased level of burnout associated with increased use of alcohol and drugs, physical exhaustion, family problems, which can include depression and even suicide. So this is definitely something that we need to be aware of. Two populations during the pandemic, we saw physicians who were in the early hotspots. They were working a tremendous amount of hours. They were exposed to COVID, and actually, the fear of not having that protective equipment. I know that was a case here in South Florida. We experienced a lot of that. The fear of contacting, COVID, bringing it home to your families. And really, how do we treat our patients? Early on, these were a lot of the problems that were costing us a lot of stress and frustration. I know for me, myself, working at Jackson, it was very hard for me to come home. I had to strip in the garage, and I was anxious about, what was I bringing home to my kids? And then we had the other group of people that really weren't in those hot areas where they had to cut back on elective procedures, which meant decreased finances for them. Patient volumes and revenues were decreased. And a lot of private practices struggled with making payroll. So, what happens? Increased medical errors, we have loss of professionalism, decreased patient satisfaction, and this can cause stress, anxiety, depression, and suicide, which has increased in physicians. So what do we know about excessive stress? Well, what we do know is it damages to the key brain structures and really reduces our ability to deal with future stress and increases our levels of anxiety and can lead to chronic depression. We can have onset of post-traumatic stress disorder, which has been seen in other times, right, with like Ebola and other pandemics. And so that hasn't changed with us. We're seeing a lot of post-traumatic stress disorder as a result. When we have a high level of stress, as we all know as physicians, our immune system is decreased as well as our inflammation response is heightened. And what are the different types of stress? I always like to tell people, a lot of people don't realize that there's, eustress, right? Which is making a deadline. What does that mean? And that's actually the good kind of stress. It's the stress that I like. The stress that most people are seeing, right? And that's the kind of making a deadline, packing for a trip, it's that kind of stress, which is a good stress. It kind of keeps us motivated. But the episodic stress would be something like COVID-19, where you can actually, see those things. Are you guys seeing the slides? You're not. Okay, I'm sorry. So I thought I was showing the slides, so I apologize for that. For some reason, I'm telling you, today the technical difficulties have been beyond. Do you see those now? No?
We see the slide, but it's not in presentation mode. At the top left, it says from current slide.
And that's what I clicked on it, but it's not working for some reason.
Oh, weird.
I know, I'm just having beyond technical difficulties today. So I apologize for that.
Okay.
Let's see.
If you go to the bottom, you will see the different areas that you can put the presentation in there.
No, I know. And I usually do it from the beginning, but for some reason, let me try one more time. Putting it from the beginning.
Oh yeah, weird.
I'm clicking on it and it's just not doing it.
So you can pass it one-on-one and we can see them.
Yeah, I'll definitely, if you, I'm sorry for that, but all right, so let's get back to the signs. So signs caused by stress in us, right? So we have the physical signs, and those are the ones, where we get high blood pressure, changes in our weight because we're either eating too much or eating too little. We get frequent colds or infections, changes in our libido or our menstrual cycles. The psychological ones are the ones where we're really having difficulty, concentrating, excessive worrying, periods of anxiety, trouble even forgetting things, right? We're not able to kind of, keep on task as we normally would. And the emotional changes include things such as, frustration, irritability, changes in your mood, personality, all those things affect us as well. And I wanted to share this with you. These are, this is by physician Edward Carl, MD, and he talks about the 10 commandments of physician wellness. And I thought this was so clever and so relevant to us, right? So number one is thou shalt not expect someone else to reduce our stress, right? So what he talks about here is he talks about, we should take advantage of ourselves and really, check in with ourselves. How much stress are we taking on? And should we be taking on more stress than we are, right? Number two is shall not resist change. And, we have to always remember with change comes opportunity for growth and opportunity for improvement. And when we resist it is when that causes us more change. So we change those things we can control and the things that we can't, we just need to let them go. Remember to not take thyself in vain. And again, self-care, checking in with ourselves and doing things that are really important for us. And we'll talk a little bit more about that in the time that I have left. Remember what is holy to thee. And that's just about what are our values, what really is important. And we should live our lives that way. Honor thy limits. And that's just really about not taking more than what we really can. And that happens a lot of times, even with myself, I sometimes take on more projects than I should, just because sometimes, we're overachievers, we want to do it all and we want to do it well. Thou shalt not work alone. And that refers to really, reaching out to others and getting that support, colleagues, working with colleagues, running things by them, I haven't been feeling like this. This is what's been going on. What do you think? Thou shalt not kill or take it out on others. And that's just really about controlling our emotional state and what things can we do to reduce our anxiety and our irritability. Seek to find joy and mastery in that work. And that's really about revamping our purpose, right? There's so much to be said about purpose in life, and that's what really keeps us motivated, gives us energy, keeps us going. And we sometimes lose it because of the burnout, right? Why am I doing this? The passion that you had when you first started medical school sometimes kind of gets lost in the weeds, when we get overworked. Seek to find joy and mastery in the work. Don't work harder, work smarter. Of course, we all know that. And thou should continue to learn. And I think that's something we all do, right? So when we talk about a little bit about resilience, and that's really what keeps us going through this time, right? So growing in resilience. So these are some of the things that we really should be practicing to improve our dealing with and coping with anxiety and stress and all the issues of burnout that we do see every day. So hope, it's always about, creating optimism, accepting change, and learning to be flexible, right? We the branch of the trees, if they don't bend, they break, right? So we have to learn to be flexible within our lives. And always remember that whatever the struggles, whatever the challenges, they're always transient, right? Nothing lasts forever. So always keep that in your mind. Cultivate gratitude. This is one of my favorite things to do. It's about savoring those small things in life, those things that bring us happiness and joy, and identify 5 things every day that you are grateful for. And this is a great practice to start your mornings. I practice this every morning because I think it just brings me so much fulfillment for the rest of my day. And actually the days that I don't do it, I notice a difference in my attitude. Practice mindfulness. And that's just about being in the moment. And I find this helps a lot when, especially you're under a lot of stress. If you just take a few minutes out, you take a deep breath, you maybe meditate, you go for a walk, you go outside, use your 5 senses and ground yourself. And always be aware of negative thought patterns, because I think that's really what brings us down and deteriorates our behavior. Forgive. It's about being generous to yourself first and foremost, and then to others. And always remember that, difficult opportunities always bring the opportunity for discovery, for learning, and really always having realistic expectations. I think sometimes we really defraud ourselves when we don't do that. Reflect, again, finding meaning in our purpose and what our role is in this time. Connecting is very important, and that's about really investing meaningfully into relationships, all relationships. Practice vulnerability and be able to seek support and compassionate people and people that you trust, right? And of course, always, speak to someone if you feel like you're really struggling more than you have in your past. Live your values. Remember always, what is really important to you. And that should guide your actions, right? What your values are, what your moral compass is. Engaging in self-care. It's about checking in with yourself. Are you getting your basic needs met? And you should always do one pleasurable thing every day, no matter what it is, no matter how simple it is. If it's, turning on, the radio in the car on the drive home and just blasting your favorite music, do that. And of course, those things that we tell our patients every day that we sometimes don't practice ourselves, right? So it's exercise, and we should be exercising, at least 5 times a week. Practice mindfulness, and that's super easy to do many times. I sometimes even tell, my friends and my patients how important it is to if you just go outside and you just look for a color. I like looking for the color yellow, and that just brings you down to mindfulness, and really you are in the moment. Deep breathing techniques. You could do that 5 minutes in your office. Just you've had a terrible patient, a terrible morning, sit back, do deep breathing for about 5 minutes. Good sleep hygiene. I know this one's hard to accomplish, especially if we're working too long and too many hours. I have friends that tell me, they work, 10-hour days, and then they come home and they're still documenting in their electric medical record. Quality time with family and friends is very important. And of course, practicing that self-care that I've been talking about. This is my favorite one, and this is an easy one. And I always like to put this in when I talk about this. It's about laughing. And laughing, it's hard for you to be anxious if you're laughing. It's positively good for your health. It reduces the stress response, improves your immune system. And actually the studies have shown that people that are actually with cancer in groups with laughter intervention actually do better and respond better to treatment. I personally like, laughing with my family and my friends and listening to comedians. That really helps me. 3 fast acting stress release strategies, believe it or not, is getting a hug from a loved one. And that includes our furry humans, your dog, your cat. It actually increases and improves our well-being. Go for a mindless walk and practice gratitude. And I can be changed by what happens to me, but I can refuse to be reduced by it. Here are some references, and it's 12:30. I know this is a 30-minute meeting, and I really do apologize for the inconvenience of the tech. And I'll be more than happy to come back if you wish me to come back and I could expand on some of these things. I will be sending the presentation electronically, because obviously I'm getting a new computer after today because I'm having lots of issues.
Are there any questions? All right, well, it doesn't sound like it. Thank you so much for your time, and I'm sorry for all the chaos. Thank you so much. It was a great presentation. And yes, like we mentioned, if you send Angel the PowerPoint, we will post the PowerPoint and the recording to all of our memberships for viewing.
I appreciate it.
All right, thank you, everybody.
Thank you. Bye-bye.
Bye-bye.
Thank you. Thank you for a good talk.
Thank you.